said, the markets are closed today, so we won't be talking about that. But oil did drop. Oil futures did drop off their 4-month high, so that's some good news. We'll see how long it lasts. A lot of it's got to do with the warm weather that has helped. That is killing natural gas right now, by the way. But the warm weather, we had the hottest summer we've had on history and a fairly warm winter. So it's good for me, for those of us who live in the Northeast. But anyway, that's where we are. That's all I've got to report. As I said, we're going to talk a little bit about Obamacare. You know I love to talk about Obamacare. But anyway, I read a book over the weekend called Beating Obamacare. Now, some of you may have seen Betsy McCaughey on Fox News and other places. And one of the struggles I had when I saw her last week, I was like, man, she needs more time. We've got a lot of things to talk about. So I wanted to get her on here to talk about this book. It is, I didn't read all the notes I got with the book. I actually read the book. It is a very easy read. It is something you all know. I don't have a lot of authors on this program, practically none. I'm very sensitive to have something that I know my listeners are going to need, want to have, and should have. This is one of those books. It is not a book you read and give away. It is a book that you read and keep. It's a handbook, and you need to encourage everybody else to have it. It is truly a very well put together. I know you're going to enjoy it because you all have the same questions I have on Obamacare. And Betsy McCaughey is a health policy expert, constitutional lawyer, patient advocate. She was the former lieutenant governor of New York. In 1993, she was one of the folks. Dr. McCaughey pointed out, she did something that we don't do much in Congress, but she actually read the 1,362 pages of the Clinton health care bill. You may remember that. And she was the one that warned back when mainstream media would actually put out warnings and cover the news. She put out the warnings on the Clinton health care bill. She was one of the first to do that. And she has been doing that on Obamacare, and she's written this incredible book, Beating Obamacare. Betsy, thank you for being with me. I sure appreciate it.
Welcome. I am so glad to join you this morning, and I'm glad the markets are closed because it gives us time to actually wade through what could be a complicated issue, but I've dedicated myself to making it understandable.
Betsy, you've done something that nobody in Congress has done, is that you've read every single page.
All 2,572 pages. I actually have the law right here on my desk. But it's also up on my website, so if anybody wants to come and check it out, you can do that at BetsyMcCaughey.com. But don't spend your time on that, because Beating Obamacare really translates this enormous law into a short, readable version.
It really does.
Only members of Congress would do that, right?
Yeah, isn't that the truth? You did an unbelievable job on this book. I read it very quickly. I made my wife read it yesterday. She wasn't. She's, I deal with this stuff all day. My wife is been in healthcare. She's an RN for 35 years.
Well,
and
she's really going to care about this.
Well, you know what? She's on the administrative side now on a very large hospital here outside of Philadelphia that is one of the few hospitals that has left a long-term care facility. And she does the paperwork for Medicare and Medicaid and all that stuff for the hospital, and is in charge of some of the administrative acts. So she's said, oh, my word, I gotta buy 6 or 7 copies of this to give to everybody at work. They need to read this, because her complaint has been nobody there at the hospital, the administrators. They have no idea.
That's right. And hospitals are going to be clobbered under the Obama health law, because cuts to Medicare, that's the biggest source of revenue for hospitals, cuts to Medicare pay for over half the Obama health law. Hospitals, for example, will have $247 billion less money to spend on the same number of people than if this law hadn't passed. And as Richard Foster, the chief actuary of Medicare, has warned Congress, some hospitals are going to stop accepting Medicare. Of course, where are seniors going to go when their hospital stops taking Medicare?
Betsy, one of the things that I've been saying since before the election was, does anybody out there really believe we can cut $600 billion out of Medicare and not affect the quality of care that we get?
Well, it is going to affect the quality of care. And Foster has been very articulate about this. As I said, he's come before Congress twice, warning that even the hospitals that continue to accept Medicare are going to have to spread nursing care very thin. That's what hospitals do when Medicare cuts payments. They lay off nurses, they increase the nursing workload, and that has a very direct impact on the ability of patients, particularly older patients, to survive their illness and make it home again.
Mm. And it's going to impact the economy, as I've said on the program over and over again. I mean, there's people that are going to get laid off. We're already seeing the effects of, employers cutting employees to 30 hours or 28 hours, as Wendy's is doing out in Ohio.
Let's talk about that one for a minute, because that's going to affect so many people, and they're unaware that it's happening. It's going to happen in the next 6 months or so. Mm-hmm. Most Americans get their health coverage at work through their own employer or through their spouse's employer. And they're going to be hearing in the next 5 or 6 months, we've decided to drop coverage. McKinsey & Company, one of the leading management consultant firms in the U.S., has predicted that as many as a third to a half of employers are going to say that. And the reason is very clear. In 2014, this law requires employers with 50 or more full-time workers to provide coverage, but not just any coverage. They have to provide this one-size-fits-all government-designed plan with an essential benefit package, that's what they call it, that will actually cost about twice as much as what many employers currently offer. So employers are looking at this and saying, I can't afford that. I'm going to drop coverage altogether. Or some employers are saying, I'm going to push my workforce down to part-time status, 30 hours or less, to evade the law entirely.
Mm. And, it is also going to affect the quality of care of people that they lose if they lose their employer-sponsored plan. If they do have enough money to get a private plan, it's still going to affect, isn't it, this care, how private, even though you have private insurance, how physicians and hospitals treat patients.
I'm so glad you pointed to that. It's one of the key issues. Section 1311 of this law, for the first time in history, puts the government in charge of your care, even if you have private insurance you paid for out of your own pocket. That section of the law says that your insurance company can pay only doctors who do whatever the Secretary of Health and Human Services imposes by regulation in the name of quality. So, for example, it could mean the Secretary telling cardiologists when they can use stents versus bypass, or telling OBGYNs when they can do cesarean sections, or, in reference to this latest controversy about firearms, telling doctors that they must all screen patients for certain questions. Have you ever had domestic violence in your family? Do you have a history of mental illness in your family? There's really no limit to the kinds of regulations the Secretary of Health and Human Services can impose on your doctor treating you, even though you paid for the plan yourself.
It's unbelievable. And I know that one of the things that concerns me that I've talked about many times is there's going to be a review panel in D.C. of bureaucrats that are going to make certain decisions. Now, I think the way it's framed, I read it somewhere in your book, I think it was in the last chapter, talking about that it's framed in such a way that it's really talking about payment, right?
Oh, yes, but it's really a rationing board.
Right.
It's called the Independent Payment Advisory Board, and let's put this in context. As we've already said, cuts to future funding for Medicare pay for over half this law. But in addition to the cuts already in place, this board is charged with making further cuts. Now, the weasel language in the law says that this board cannot reduce benefits. But if you say that you're only going to pay $2 for a doctor to do a hip replacement, you're not going to find a doctor willing to do it.
Right.
And that's why changes in reimbursement, which this board is in charge of, has the practical effect of rationing care. But even before we get to 2016, let me tell you about a regulation that went into effect last October. And this may be the most shocking provision in the entire law, Section 3000A. It awards bonus points to the hospitals that spend the least per senior.
Oh, my word.
Yeah. Now,
this is the first time I'm hearing about that. I'm sure that's in your book. So I read it faster than I thought.
Well, and here's the practical effect. First, I'll ask you a kind of a off-the-cuff question.
Okay.
If you own a dog, I happen to be a dog lover, you wouldn't take your pooch to the vet who spent the least per animal. So why would you take your mother to the hospital that spent the least per senior? But that's what they're suggesting, that these hospitals are going to get bonus points, and it will increase their reimbursement from the government based on skimping on care for seniors. And we know that this is going to have a very damaging effect on the ability of seniors to survive their hospital stay. There's a big study of all the hospitals in California in the Archives of Internal Medicine last year, and it showed that the hospitals in the bottom quintile, the ones that spent the least per senior, had 15% higher death rates from heart attacks. The patients in those hospitals had a much smaller chance of making it home after their heart attack or after their bout with pneumonia. And now here's the federal government incentivizing all hospitals in the United States to imitate the ones where the seniors did the worst.
That is, and the hospitals are going to have to take up on the incentive clauses because they're going to be in such dire straits from a financial standpoint, a revenue standpoint, that they're going to do everything they can to try to survive.
Oh, yes, and that's exactly what the chief actuary of Medicare told Congress, that hospitals will be operating in an environment of extreme scarcity and financial stress. And, of course, that will impact care for everyone, because once you spread those nurses thinner, you get worse care whether you're a senior or a 10-year-old boy or a middle-aged person.
Right. And my wife says they're already seeing that. I mean, they already saw that last year with some of the new legislation that affected rehab for seniors.
Oh, let's go to that one. That's really important because that deals with just what we're discussing. This calculation of how much hospitals spend per senior, they include all the care used by the senior for 30 days after discharge from the hospital. So here's the practical effect. If you go in for a hip replacement or a knee replacement and you need rehab, right? Anybody having that kind of orthopedic surgery, one of the most common operations for seniors, needs rehab. But now the hospital's going to get whacked with demerits for prescribing that rehab because it counts against their spending even though you're not in the hospital anymore.
So even though you're in an outside rehab facility.
Absolutely. That's going to discourage hospitals from prescribing the aftercare you need when you leave the hospital.
You know, I all I can think about are the people, and there's so many of them, that are alone, seniors, that have no advocate. Or maybe they're not alone, but they're
mystified by the system. It is complicated.
It's just, oh my word.
I would love to meet your wife because she and I could talk for hours about how to protect seniors from some of these perverse regulations.
Well, I'll tell you, she has just been so outraged at their facility, the hospital, just in the whole rehab issue. So where you got one-on-one rehab, now the physical therapists have 6 seniors that sit in a circle, she says, and the one physical therapist does one at a time and then moves to the next one.
So each one gets 1/6 as much care as in the past.
Exactly. That's exactly right.
Terrible.
And it is just horrible. And you also, in the book, have some great statistics in reference to Europe.
Oh, yes, because Europe, of course, where the government pays an increasingly large share of the care, when that happens, government has to make ends meet, and they do it by this kind of silent or covert rationing. And that's exactly what we're moving to. It's very damaging. People think they're going to get all the care they need when they're in the hospital, and they don't know why grandma didn't make it. They don't know why they didn't heal well after that hip operation.
I looked at some of your charts in the book. Folks, before I get any further, we're talking to Betsy McCaughey. She's written a book that you absolutely must own. Don't own it to have it sit around. Read it, keep it. It's a handbook. It's Beating Obamacare. It's by Betsy McCaughey. Now, I'm going to spell her last name because it's spelled differently than it's pronounced. It's McCaughey.
Right. That's a mouthful. But you can get this book at barnesandnoble.com or at your local bookstore.
And if you Google Beating Obamacare, you're going to find out where to buy it.
Right.
So Beating Obamacare, we're talking to Betsy McCaughey.
Give baby boomers a few suggestions on how to prepare for this this new world of Medicare with less care, because baby boomers who are going to go into Medicare in the next 3 or 4 or 5 years are going to get a lot less care than seniors currently get. And one of the things they're going to find out is how hard it is to find a doctor, because under this new Medicare system, doctors are going to be paid less to care for a senior than for any other kind of patient, even less than they're paid to take care of somebody on Medicaid, right? So if you're 60 or 58 or 62, lock in relationships now with an internist, with a cardiologist, because if you do, when you hit 65 and go on Medicare, they're unlikely to drop you. But nobody's going to be willing to take you on as a new patient when you're 65 and you're on Medicare.
Wow, that is a great piece of advice that we should be thinking about. And also, I've got a 70-year-old sister that said to me yesterday, she said, so if she has supplemental insurance that so many people on Medicare have. But it's yes, it's going to go up in price, but it's going to be somewhat irrelevant if you have that.
Boy, are you
right?
smart about this. Irrelevant, because when you get to the hospital, the standard of care will simply be lower.
Right.
Fewer nurses, less equipment available, less cleaning, and the result is a poorer chance of surviving your illness.
What are some of the other things
let's
baby
talk
boomers
about younger people who are going.
Okay.
They're going to find, if they get dropped at work, they're not going to have the option of being uninsured, because when you go to file your taxes, you have to attach proof that you were in the government-designed plan. Otherwise, you don't get your refund. So many, many, many people will find themselves on what's called a health insurance exchange. Nobody's ever heard of that before. But every state's going to have one, whether the state sets it up or the federal government does. And it looks like a DMV office and an 800 number and a website. And it's like going to a supermarket that only sells cereal, or going to a car dealership that only sells four-door sedans. No hatchbacks, no convertibles. The assumption is we're not smart enough to pick the kind of health insurance we need. Everybody has to get the same kind. And
you're going to go there and pick the plan you want, or not even pick a plan, just take the plan.
Right. It's going to have different names on it, Aetna, Cigna, WellCare, but it's all the same. It's all the same. It's the essential benefit package. Now, here's where you don't want to get bamboozled. They're going to have four grades of this: bronze, silver, gold, and platinum. This is not like walking through Tiffany's. These plans have the same essential benefit package. What's different is the copay. And if you spring for the platinum plan, you're going to pay a lot more in the premium, but have a smaller copay when you go to the doctor. Don't think you're getting a higher level of care. That's not what it's about.
And the medical savings plans for those high deductibles
very hard to get.
Are changing. They're going to be changing. Mine's changed already this year.
Because
I'm self-employed.
They're going to have to provide you with all that routine preventive care that you'd rather pay for out of pocket than through insurance. You're not allowed to do that anymore.
And there's no real incentive to do it, really, because you're not getting the quality of health care by doing that anyway.
Right.
So let me ask you something that I've been talking about from an economic standpoint. I believe that one of the unintended consequences of this, and there are many, one of them is that there is no real moral hazard for an employer. In other words, there may be an employer that would say, I know the health costs have gone up. We're trying to do our part. We don't want our employees to be without health care. We're doing everything we can. But I believe that we've created a little bit of a moral hazard where corporations are going to say, look, does it really matter? They're going to get their Obamacare. They're still going to be covered. Why should we even bother anymore?
Absolutely. All the incentives are for employers not to provide coverage. The penalty is far less than the cost of coverage, and all employees who don't get coverage at work will end up either on Medicaid or in the health insurance exchange. So there's a big incentive, and in fact, you're going to find this amazing. I did. The federal government's own economists and actuaries predict that fewer people will have on-the-job coverage after this law goes into effect, after the employer mandate kicks in, than before. Imagine only Washington could invent an employer mandate that reduces the likelihood you'll get insurance at work.
It's unbelievable. It really is, and it's just scary. I just, I said before this bill was passed, I said, the worst piece of legislation in my opinion I've ever seen on Capitol Hill was the cap and trade bill. I thought it was an unbelievable power grab, an unbelievable piece of social control. It was going to ruin and control small businesses, large businesses. It was a horrible bill. Now it's kind of been shifted to regulation in the EPA, so we're still going to get clobbered by it. This power grab and social control is real. It is in place. And is there anything, Betsy, that you see in the future that we can do to, once we get fully engaged, which is going to be January 1st next year, right?
Yes, although much of it is rolling in this year. That's why I wrote Beating Obamacare for right now, because many things are happening in the next 8 or 10 months you need to know about.
So once we get fully engaged, is there any turning back?
Yes. Not in the next 2 or 3 years, but I believe in 4 years, if we have a change of administration in Washington, there will be a chance of repealing this law. And the reason I say that is that people are going to be stunned to see the decline in care in hospitals. They're going to be stunned to see how much their insurance premiums go up in the next year. As you know, premiums have risen a lot in the last 2 years. There's a simple lesson here. There is no tooth fairy. If you require insurance companies to pay more, you're really compelling consumers to pay more, right? The insurance company has to cover children on their parents' plans till they're age 26. Well, that means that consumers pay a higher premium. And perhaps one of the sleights of hand that really pushed up health insurance premiums was this notion of free preventive care. Free mammograms, free colonoscopies. Yeah. Of course they're not free. You're paying for them ahead of time in your premium. So when you go to the doctor to collect that service, if you choose to, you don't pay a copay. But, from my point of view, being forced to pay for a colonoscopy feels almost as bad as getting one.
Right. Oh, brother. This is truly a book that you have to have. We're running out of time. I would love to do. I'm gonna call you. We're gonna do a 1-hour special, and maybe package it up in a DVD or something. But people need to hear more about Beating Obamacare.
Well, I'd be delighted because you're so well informed. It's such a pleasure to talk with you.
Well, I'm just. I've sat in emergency rooms in Europe, and I used to say before this bill was passed, go over to Ireland or England and sit in an emergency room for any day of the week, see what it's like. It just makes your heart ache is what it does. But I sure appreciate, listen, it's Beating Obamacare, folks. Betsy McCaughey, Beating Obamacare. It is not something that you should read. It's something that you absolutely must read and you must own. You must have this book. It's 150 pages. You can read it easily. You can mark it up. Keep it as a handbook. As a matter of fact, your handbook for surviving new health care law. That's what this is, Beating Obamacare. Make sure you get it. Betsy McCaughey, I sure appreciate it. Thank you so much, Dr. McCaughey.
Thank you, Dan.
All right. God bless you. Thank you.